Meanwhile, maybe Health and Human Services Secretary Kathleen Sebelius needs a math lesson.
What's the $500 billion cuts for? Preserving Medicare or funding health care? Which one?
Both.
The gentleman.
So you're double counting.
Both. This is just the latest in a string of embarrassing problems with Obama's health care law. So is the law just one big mistake? Let's debate that fair and balanced style. We are joined by the chairwoman of the Independent Women's Forum, Heather Higgins, screen left, and Democratic strategist Crystal Ball. She's oddly screen right. We should have you on the left. Crystal, let's start with you.
All right.
Kathleen Sebelius just admitted that the administration is double counting, and that is not legal.
Well, I think this is a little bit of a tempest in a teapot. It is a bit confusing, I agree with you. Essentially what we're doing is we've found $500 billion in savings from Medicare, primarily from combating fraud and also dealing with the extraordinary taxpayer ripoff that has been Medicare Advantage. And we are using that money to provide additional health care coverage to millions of Americans.
You're saying that they're double using it as well. But Heather, the problem is they're taking the $500 billion out of Medicare to actually sustain that program, not to fund health care, although they're using it for both.
That is correct, and people who are critics, and I want to state that this is not actually a left-right issue. It really should not be, except for hardcore partisans, a Democrat versus Republican. The American people, across political parties and across sexes, ages, they dislike this bill intensely, and yet we find that they keep jimmying the numbers, using arguments and promises that just bear out to be totally untrue. And one of the things that also came out in the hearing yesterday, for example, is that Secretary Sebelius stuck back in all those controversial end-of-life provisions that had been taken out just prior to the midterm elections, as though they weren't going to put them in. But she has been granted extraordinary new powers. This entire legislation, people need to understand, it's not about some sort of subsidy to help you afford health care. In fact, it's a very authoritarian, elitist command and control. The government bureaucrat decides, not you.
Okay.
Well, here's the part of that argument that's very intellectually dishonest. Medicare is the largest entitlement program that we have. Agreed? And you can't, on the one hand, say we can't cut anything from Medicare. Medicare has to stay exactly how it is. We have to plow all these dollars back into it. And on the other hand, say health care is a brand new, great big entitlement program. You can't defend entitlements on the one hand and lambast this program on the other.
You are setting up such a straw man.
It's just not an honest argument.
No, nobody is saying that, and I don't know what sort of false representation you heard someplace to say that somebody is arguing that. There are great problems with Medicaid, for example, and this expands that rather than fixing it. It gets rid of Medicare Advantage, which is probably the model for moving us out of the present system into something that becomes more affordable, where individuals have greater choice.
Ladies, we're going to have to leave it there for right now. Excellent debate. Heather Higgins and Crystal Ball, thank you.
Thank you, Steve.